We're going to move on to the final question of the evening. Are there enough provisions for young people around mental health, and is there an ability to access these services quickly enough?
We are making all efforts to see young people as early as possible, as quickly as possible. We do have young people who need urgent care. So like I said, emergency services are available. So we do have access through our front door services via the general practitioner, the GP, or accident and emergency. Depending on the need, we have broadened our front door. So when we talk about a single point of access, I don't know if young people may or may not be aware, all of us between health, education and social care, along with volunteer organizations, are working together to understand the need and to see who is the right service, who is the right person that has good knowledge of the young person, that already knows what their difficulties are and already is there to support. And our crisis teams work very closely. So anyone in crisis will get a response within 24 hours, irrespective of it is a weekday or a weekend. And like I said, it is not just one person or one service. We work collaboratively with a lot of our partners.
We work in partnership with other organisations, and that's because we recognise that, you know, trying to get involved early in young people's lives and to try and shift things in a preventative way is really important.
Yeah, we are available and accessible, direct work for some, indirectly through people who are already involved.